Did you know that some heart diseases can be identified just by looking at the body? Sounds incredible, right? But it's true. Your body sends signals that can reveal potential heart conditions before they become serious problems. Today on Organic Awakening, I'm going to show you 7 visible signs that may indicate heart disease. These signs can appear on the face, eyes, skin, ears, and even fingernails, and recognizing them early can be life-changing. So stay with me until the end of this video because this information could help you or someone you love stay ahead of heart disease. This advice comes from top cardiology research and experts specializing in pacemakers and cardiovascular health. But before we dive in, make sure to subscribe to Organic Awakening and click the bell icon so you don't miss our weekly deep dives into health, longevity, and natural well-being. Let's get started. Your heart will thank you. Cardiovascular disease is the leading cause of death worldwide. These diseases can increase morbidity and even make it difficult for a person to perform basic daily activities. Risk factors such as high blood pressure, dyslipidemia, obesity, a sedentary lifestyle, smoking, diabetes, and family history significantly increase the probability of developing cardiovascular diseases. That's why it's so important to recognize the warning signs your body gives you, so you can prevent, treat, and avoid severe complications later in life. What's even more interesting, and often overlooked, is that it's possible to identify risk factors and diseases just by looking at a person. So today, I'll show you 7 visible signs that indicate heart risks. Get ready because today's video is packed with information. 1. Frank's sign. Have you ever heard of this sign? It's a diagonal crease that appears on the earlobe, giving the impression that the lobe is cut. This sign is linked to an increased risk of atherosclerosis and heart disease, as well as chronic circulatory problems. Studies show that Frank's sign is directly associated with heart attack risk. Of course, this sign alone isn't a definitive diagnosis, but it can reveal a lot about a person's cardiovascular health. So if you notice someone with this crease, encourage them to get checked. Have you ever heard of this sign before? Let me know in the comments. I'd love to hear your thoughts. 2. Clubbing. Watch glass nails. This condition is known as digital clubbing or Hippocratic fingers. The name might sound complicated, but it's easy to recognize. It causes thickening and rounding of the fingertips, giving the nails a convex watch glass appearance. This happens in diseases where the body lacks oxygen over long periods. Over time, the body tries to compensate by abnormally growing blood vessels in the fingers, leading to this distinctive shape. Clubbing can be a sign of serious lung diseases, including advanced COPD, chronic obstructive pulmonary disease, pulmonary fibrosis, advanced tuberculosis lung cancer in its later stages. It can also appear in certain congenital heart diseases, such as cyanotic heart defects, e.g., tetralogy of Fallot. So it's worth being aware of this condition. 3. Xanthelasma and Xanthomas. Xanthelasma refers to yellowish plaques that form around the eyes, usually on the upper or lower eyelids. They often appear at the inner corners of the eyes. Xanthomas, on the other hand, are yellowish, fatty deposits that can develop on the hands, elbows, knees, or other joints. These signs are more common in women and people over 40. They're caused by cholesterol deposits in the skin and tissues, often indicating high blood cholesterol levels. Both Xanthelasma and Xanthomas are associated with a higher risk of heart attack and atherosclerosis, even if cholesterol levels aren't extremely high yet. 2 other signs linked to lipid disorders are lipos, which are small, fatty nodules that can appear on various parts of the body, arcus cornealis, a grayish or whitish ring around the cornea. This is more commonly seen after age 50. Marfan syndrome. People with Marfan syndrome are typically taller than average for their age. Their arm span exceeds their height, and their fingers are unusually long and thin, creating a noticeable disproportion. Some individuals may also have deformities in the sternum, the bone at the front of the chest. A common characteristic of Marfan syndrome is joint hypermobility, making individuals highly flexible. However, one of the biggest concerns is the increased risk of aortic aneurysm, meaning their aorta must be regularly monitored. These individuals may also be more prone to mitral valve prolapse, which in some cases can progress to mitral regurgitation, requiring follow-ups with a cardiologist. To understand this condition better, Marfan syndrome is caused by genetic mutations that affect connective tissue throughout the body. This explains the heightened risk of aortic aneurysm and aortic dissection, the latter being a severe and often fatal condition. However, not everyone diagnosed with Marfan syndrome will necessarily develop an aortic dilation. The risk depends on the severity of the mutation, preventive treatments, such as medication, and proper follow-up with a cardiologist. Cyanosis refers to a bluish or purplish discoloration of the skin, lips, and mucous membranes. It occurs when oxygen levels in the blood are significantly reduced, signaling an issue with oxygen circulation in the body. This can indicate serious heart or lung problems. Cyanosis can be linked to severe lung diseases such as advanced emphysema or pulmonary embolism. It may also appear in cases where blood flow decreases, even if oxygen levels are adequate, such as in congestive heart failure, where the heart struggles to pump blood efficiently. In newborns, cyanosis can be a sign of serious congenital heart defects, such as tetralogy of Fallot, transposition of the great arteries, truncus arteriosus, or tricuspid atresia. Depending on severity, cyanosis can appear immediately after birth, sometimes requiring urgent surgery within the first weeks of life. If you notice cyanosis in someone, especially if it occurs suddenly alongside shortness of breath, chest pain, or dizziness, seek immediate medical attention. Leg swelling, edema. Swelling in the lower limbs is a common condition, often manifesting as puffy feet, ankles, or legs. This could be a sign of heart failure, particularly when accompanied by shortness of breath and fatigue. Since the heart is unable to pump blood efficiently, fluid builds up in the extremities. However, edema isn't always caused by heart issues. It can also result from kidney failure, venous insufficiency, or liver disease. A thorough medical evaluation, including physical exams and medical history, helps determine the exact cause. What's most important to remember, having persistently swollen feet or legs isn't normal, and the underlying cause should be investigated. Osler's nodes. Osler's nodes are small, painful, reddish nodules that appear on the fingertips or toes. They are associated with infective endocarditis, a severe heart valve infection caused by bacteria or fungi entering the bloodstream. For example, an untreated dental or skin infection can allow bacteria to spread into the bloodstream and reach the heart, leading to endocarditis. Osler's nodes form when small bacterial emboli block peripheral blood vessels, triggering an inflammatory response. Patients with endocarditis often experience fever, chills, and a heart murmur. This is a life-threatening condition that requires hospitalization and intensive intravenous antibiotics to eliminate the infection. As you've seen, the body can exhibit several visible signs of cardiovascular disease. However, these signs alone do not confirm a diagnosis. If you notice any of these symptoms, consult a cardiologist for a thorough evaluation. If you found this information valuable, share it with as many people as possible to spread knowledge based on scientific evidence. Take care and see you next time.